if I may add something in the context of the word that we heard, I don't know, I was going to count probably 100 times, innovation. It's funny you brought up gene therapy. The first biotech company that I was recruited to in San Diego back in 1992 was a gene therapy company. And in those days, in the 90s, the investment in this industry was truly all about innovation. You heard from the venture community that limited partners were flowing in there because there was the perception that the science was going to dictate and lead the way. And you know, when we started in gene therapy, the FDA had not only had no one at the FDA that knew anything about gene therapy because it was such a new field, but there wasn't that fear that there wasn't going to be a pathway that could be generated because the feeling was that science was going to win out, both in the companies to develop the innovative products and through the FDA, that ultimately the process would be defined well enough that the venture community would not go away. That's completely the opposite now. I mean, there is a fear, an absolute fear in innovation, and you heard a bit of it here, in the venture community, not so much that the science isn't good, but there's no predictability and no trust that a pathway will ever be developed. And even when you have a drug that goes all the way through the process, you've had your agreements, you know, you add the issue we had talked about relative to the scientific advisory committee meeting and not having people on there that are even capable of understanding the process. We're in dire straits. If it doesn't get fixed, we may not see it for 4 or 5 years. I'm more concerned not about the drugs that are currently in phase 3. It's the pipeline that's not going to be there 5 or 6 years from now, where you're not going to have to worry about regulating innovative drugs because there's not going to be any there because there wasn't any financing. And it's not just the venture community. Look at the large pharmaceutical companies. They're eliminating their R&D organizations because they can't even manage or feel comfortable in managing. That's a good investment on our part. I mean, shipbuilding is close, but I don't think not even close to being as dire what we're in for in the future. And when I talk to my colleagues within the industry, there's depression because the science is better now. It's better than it was 20 years ago. We can develop. It's remarkable the kinds of things that we can do. You know, with the electronics, but also with gene sequencing and marker analysis. But there's no way that we can convince investors that there will be a pathway, that the FDA is going to get up to speed, and that even if they are, they're going to have that pathway is going to be predictable enough with a trust level that if it really does meet its endpoints, it's actually going to get through and not be stifled by some people that are evaluating, that are in the process at the end stage, don't even know what they're talking about. So I don't know how you fix that.
Okay, Doctor, you raised a whole new concern that we need to follow up on and we get into. And in all fairness, you're right. It took decades to lose the shipbuilding or the auto industry. It'll take months to lose the research facilities. But the prejudice, the prejudice of people that claim to be based in science, but bringing prejudice in, and the gene issue was a good example, where top oncologist here at UC tells me flat out, we're this close, if there was any opportunity, you're this close to the breakthrough, but it's been stopped dead in its tracks. And resources and everything else are moving off, and to see somebody whose entire life is devoted to trying to save life, the frustration of seeing a system that basically takes prejudice and discriminates against a certain scientific approach based on ignorance, and to claim they are somehow being informed decision makers, just I think is one of those things that we need to talk more about and look at, and that's one thing our committee's got to look at, is the prejudice. I mean, we just got this big scandal that's coming down that the doctor and I is working on of a certain kind of energy technology, and the prejudice led them to major mistakes that cost the taxpayers $500 million. The trouble is with your field, we're seeing bureaucratic prejudice that are standing in the way of not just the creation of jobs, but the saving of lives. And that sure makes what went up in San Francisco look second rate.
Let's go.